Good evening, everyone. Welcome. I'm very happy to welcome Dr. Troy Heidesch here today. He has been in the trenches long enough to know what it really means to care for patients, unlike me. But more importantly, he is the CEO of a company called Smart House Calls. It's a telemedicine company that he started 3 years ago now. And we started working together, looking at what could we potentially do about 2.5 years ago, and since then have become good friends. So he's got great insights into how to make technology work for important clinical purposes. I'm very excited that he found the time to come.
The idea for me ultimately came out of my experience being a nurse practitioner, working in both family medicine and ER medicine. And I saw that problem, and I don't know how many of you, and maybe I'll start off with this, sort of asking this question, how many of you have ever gone to your doctor and wondered, why the heck did I spend an hour sitting in this waiting room for him to talk to me or her to talk to me for about 10 minutes and then usher me out with a prescription? Okay, so at least half of you. And how many of you have ever had a family member or you've ever done this where, hey, you actually need to talk with the physician or the nurse practitioner or PA, and you call up the office and you never get to talk to them. You're shuttled around between receptionists, medical assistants, techs, office managers, and it seems like they do anything they can to prevent you from getting to the physician. Well, ultimately, that's kind of where that sort of was born out of in what I saw. Essentially, the way we work in medical practice, because we're having, we don't have much for, our reimbursements are low, we're constantly under the gun, the reimbursements keep shrinking, overhead continues to increase, and so we're shuttling through 30 to 40 patients a day at times. So we're spending 5 or 10 minutes, tops, ourselves, intensely in the room on average. Now, of course, some patients will spend a half an hour, 45 minutes, and other people get 2 minutes. And it can be that bad. So the thought of 30 phone calls coming in a day and people wanting to kind of stop in the middle of what you're doing to talk with them becomes an impossible feat. And on top of that, a telephone call is free. We can't charge for it. So what we do instead is we tell the secretary, no, tell them to come in, I need to see them for that. And it's maybe not something we need to see you for. We can certainly take care of you over the phone. But we know A, we don't have time, and B, we can't get paid for it. So bring them in, and then you get to sit there, fight traffic, take time off work, sit in a waiting room full of 6 strangers that are coughing all around you, or maybe talking to themselves or talking to them in the room as you wait for us. And that came, and my vision for Smart House Calls started in that particular atmosphere, understanding that this really sucks for patients, and this really sucks for providers, because we'd like to spend more time with patients if we could, and we'd like to be more convenient, but there's no way to really do that effectively. And then I got to thinking, well, what if we replaced some of these telephone calls and some of these in-office follow-ups? What if we use telemedicine and just connected to patients right there in their own homes? What would happen? How could that possibly change that sort of dynamic? And so that's why I didn't develop myself. I went out and found the guys who were smarter than me to help me develop the software. And I essentially just sort of led the team saying, this is what we need, no, we don't need that. And we started building it. Now we've got family practice physicians, psychiatrists, psychologists, therapists, cardiologists around the country using the software in a couple of different ways. One is to connect to their own, to connect that person at home. But they're also, because the system works so well, they're connecting to tertiary care centers, they're connecting to rural health centers, they're connecting to other specialists, and effectively taking care of patients where they are, taking care of patients where it's the most convenient, and really doing it in a very dynamic way. And I like to say that really what telemedicine should be about, or what it is about, is let's stop moving people and let's start moving data. Let's make everything more efficient.